Welcome to the Think Fitness Life podcast, your one-stop shop for exploring the connections between fitness, health, and overall well-being. Join us as we dive deep into all aspects of a balanced and vibrant life, from pushing your limits in the gym to finding peace of mind outside of it. Whether you're a seasoned athlete or just starting your journey, you are in the right place to discover the knowledge and insight to perfect your fitness life.
All right, welcome back. We are lucky to have a special guest on that is going to dive into topics that might affect you every single day. We're talking shoes. What are the right shoes? What are the wrong shoes? We're talking retainers, permanent retainers, non-permanent retainers. We're talking posture. We're talking health. We're talking treatment. And we're doing this with fellow Postural Restoration Trained therapist, Aleena Kanner, who spends her time learning through the Postural Restoration Institute, learning from other holistic approaches, how she can better her practices, better her clinician skills, better her treatments, and better her patient outcomes so her clients and patients get the best care and best service to provide them with an understanding, especially in the postural restoration world, of how they got to be where they got to be. So we appreciate Aleena coming on. And welcome to the show.
Yeah.
All right, let's start. So the background of you. What made you start in personal training, strength coach, and then brought you to PRI?
Well, so actually, I am also a personal trainer, but I first was an athletic trainer, certified athletic trainer. So I have a master's from University of Arkansas. My goal was actually to work with USA Gymnastics. That was what I always had wanted to do.
Okay.
And wanted to help heal up the injuries of those girls. And I was a gymnast growing up, so I just thought that's what I wanted to do with my life. I always wanted to go to the Olympics and, heal those girls. There was a lot of controversy in USA Gymnastics at the time when I was interested in working in that specific field, and I didn't want to be involved in that. I could have gotten an internship, and I'm sure I could have gotten, ways to work there. There was so much controversy, and I was very burnt out after school, after the 2.5 years of master's where you're really working for free. And I had an amazing experience. I worked with the Arkansas gymnastics team. I worked track and field. I worked with these amazing athletes. I had Olympians, etc. However, I was burnt out. So I moved back to New York after living in Arkansas. And then I got into more strength world. Now, I was becoming an athlete myself. I became an Olympic weightlifter. So it just made sense that my schedule would be more personal training. Also, there's this thought of rehab is really strength training. And there is some truth to that. I agree in certain ways, especially for certain injuries. However, so I did that. And with that, I fell into PRI. I fell into it, meaning one of my mentors I was learning from started taking courses. And I was, wow, this is interesting. I took a course myself with Ron. And I was, oh my God, this is so complicated. I don't understand it. So I slept on it for a year. And then I took Myokin with my mentor, Casey, who teaches for the Institute. And it really helped open my eyes to seeing how the pieces of the puzzle could get put together. So really that second course for me did it for me. And then I actually moved to Texas to learn under Casey for 1.5 years. And that was during COVID time. So it was the perfect time to do it. So that's how I got where I'm at with all this stuff. I share it. I think there's a lot of other PRTs and PRCs out there doing what I do. Maybe not a lot, but there are some doing the vision, doing the dental, but I'm posting it, I'm sharing it.
Yeah, and that's one thing that I don't do. Well, I'm trying to, but I tell you, to post Instagram and make those videos, it takes a long time.
I know. It takes me at least 1 hour every single day. And
it's a lot of work.
I've been bad. So I'm, oh my God, I have to get a post out. I'm on Pacific time. I have to get something out. It's a lot of work.
Which is great because then I can always refer people out, or people find us from people you or Neil's a big one. Oh, I saw this guy on YouTube. Okay, I know it's Neil. Great. Awesome. But I think it's to have a good presence online, because a lot of people don't understand PRI, or they've heard about it and they're like, oh, that's the breathing stuff. And they're
Yeah.
just, yeah, or they've tried it and it doesn't really work. And I think that's the niche of it. And your first class with Ron.
Postural restoration in New York City. And I was used as the model. I always joke with him now. You used me as the model. I don't know what audience you have, but I'm a very straight patho PEC. I was a gymnast. I had a lot of stuff going on in my life at the time. And it's just funny because I'm sure Ron knew, because he can just look through people's souls and just know. And he used me as the model for a bunch of the stuff for respiration. He did manual work on my ribcage. And I remember being like, whoa, I feel so wildly different. I just didn't understand at that time.
Yeah, I don't think the first course anyone ever understands, or you buy in. I don't know about you, but my first time, I was, oh, this stuff, because I learned it coming out of Northeastern when I was an intern there, and I was, oh, this stuff's stupid, because it changed the way I had to work out, lift, and think about everything. And then I took a course and I was like, wait a second, this makes sense and it works. Why does it work?
Yeah. So I think the hardest thing to do is unlearn. And you have to unlearn to learn PRI.
Right. And that's where it's I'm sure it's funny for you, but I'm sure you get people, oh, are you a physical therapist? Do you take insurance?
Yeah, all the time.
Obviously, at first disclaimer, yes, there are PRCs, Postural Restoration Certified, but we're PRTs, which we can't take insurance.
Right.
That doesn't mean we don't do the same thing. It's just we can't take insurance. But a lot of people are finding that network of anyone who's associated with PRCs or PRTs to work with them. And I think it's great, because then people are now learning from that.
Yeah, what I would tell people is that physical therapists and chiropractors do what I do. We're trained similarly. It's a continuing education. As a certified athletic trainer, I cannot take insurance. And to be honest, it's a blessing for me that I can't. I think PTs that can take insurance, the name having a physical therapist, everyone knows that they can take insurance, but then they don't. I think that makes it harder. So it's interesting. Sometimes having more certifications, et cetera, is not always better. I'm very blessed and grateful that I went down the athletic training route. And as much as it was something I thought about going to PT school a few years ago, but it just didn't make sense with where I'm at. And I wanted to learn. I didn't want to have to go back, learn something, and then unlearn it to relearn. It didn't make sense for me.
And did you do undergrad athletic training too?
No, I have a whole story with that, but I did not. I went to SUNY Cortland. I could have done it in undergrad. I didn't have the opportunity. That the school ultimately did not allow me to have that opportunity. It was a very, very difficult time for me. I struggled with school a lot growing up. I've learned now why and fixed a lot of these things, and it's brought me on real healing journeys. But Arkansas, I interviewed there and they accepted me on the spot pretty much because of my interview skills.
Did anyone warn you about athletic training?
Yeah, but yes, totally. I was warned. I remember I had to interview somebody before getting into the athletic training program at Cortland, and they were like, don't do it.
So I started as an AT too on undergrad, and a lot of some of the coaches that I work with now, they went through the AT route, and we always laugh about that. So, well, at what point did you realize AT wasn't going to be your thing? And I was pretty early on.
So I actually had this situation occur where I tried to get into the program at Cortland and I didn't get accepted, and then I tried again a year later and I also didn't get accepted. It's crazy for me to be even talking about this publicly because it was over 10, 12 years ago. I'd moved past it, but it was such a deep, deep cut for me. And I just being vulnerable, it was so difficult to be so embarrassed in front of my peers for my intellect and education, how I, and I didn't get in the second year because of some political reasons with the switch over of a program director, didn't really know me, etc.
Oh, that always happens.
Yeah. And so I was really burned by that program deeply. And I had to become an athletic trainer because of that, because I would never let that define me. And so I would have became an athletic trainer regardless, even though I don't exactly practice in my field. And what's really funny is that they recently asked me to potentially speak next year for them. So,
Or something like that?
no, Portland, the athletic
Oh,
training program had like their
even
own.
better.
So I mean, I hope that happens. I would love to share my story a bit and also share with what I do, because I know as an athletic trainer, that's my background. I worked in the field, and I know that other ATs reach out to me all the time saying, "Hey, I want to do what you're doing?" And you can. So
And that's where I circle back to where that PT school discussion always comes in, because I do think it crosses most trainers' mind at some point that they're saying, do I go do that? But once you're in the PRI world, to go back to PT school, it's not even worth it. And I don't mean any disrespect to PTs, but
sure.
you have to unlearn PRI to learn the Western way of PT. And a lot of times, I'm sure you find PTs that clash with what you're coaching some of your clients or athletes or whatever. And it's a little bit different knowledge subset when it comes to it. And talking with a lot of the PRCs, actually, believe it or not, a lot of them are going to cash-based instead of taking insurance. So it's one of those things where, I mean, sure, there's some PRCs that still take insurance, but in this field where there's a high demand of PTs and PRI, a lot of them are in the cash business, driving that way. So if people are listening, I think that is one big thing to expect. If you're looking for someone who's PRI certified, many and most will probably accept cash.
Yeah, it's at the point where it's hard to find anyone who takes insurance with it, because in reality, if you are really struggling and you want to get better, you have to invest in your health to do so, because the regular system is not going to help you. And that's not just with what we do with PRI. It's not just with PT. It's not just with occupational therapy. It's with the entire system, the entire medical system. And I know from my personal experiences and all of my patients that have struggled for years trying to find answers. And yeah, sometimes you'll find a gem of a conventional, somebody who takes insurance. My optometrist, they take insurance. She's amazing. She's a gem. They're all of them at SUNY Optometry. Amazing. But that is rare. It's rare.
It is. So your aha moment in PRI, what made you want to keep going and become a PRT? Let's start there. What was it? Was it class 1? Was it Ron? Was it? I think everyone has that moment where they're, oh, I can do this. I want to do this.
Sure. So it wasn't in a class necessarily. I am not a traditional learner. I'm an extremely kinesthetic learner. I have to see and put my hands and feel. And when I am embedded into a learning environment, that's when I thrive. So school did not work well for me. I just couldn't really do school well. I managed, but it was hard for me. So PRI courses are actually very hard for me to soak the knowledge in. It's when I am there watching that I will soak it up. So I was on a trip to Texas in 2020. After everything with COVID, I felt locked up. I was living in Brooklyn. I ended up taking a trip, and I shadowed my mentor, Casey, who teaches the Myokin class. It was there where I was just shadowing, watching how amazing she was. I have to do this. I have to do this. I have to learn how to do this. And then I'm just going to drop what I'm doing with the strength coaching and embed myself as much as I can into PRI. And then I moved to Texas a month and a half later. And I just was really fortunate that she took me and taught me. And I think we both helped each other a lot during that time. Just her having somebody to teach and help and bring up in the PRI world, I feel was growth for her. And then also for me, of course, I grew you're watching this every single day. I was putting in work hours early in the morning and in the evening of training my clients virtually, because at that point, everything in New York was still virtual. So it was just a time and place thing. And I made a really amazing, amazing friendship out of it. And so that was my moment, was when I was observing PRI and seeing how it comes full circle, seeing somebody do a full assessment and then watching assessment after assessment and seeing different outcomes, similar techniques, right? All the same techniques, but different outcomes, not different in a way. Everybody felt better, even though their pain was different. And that to me was, wow, this is so, so powerful. And I think I probably even saw I don't know if I saw a dental or vision appointment at that week, but I remember some of the patients that I saw that specific week. It was so profound for me.
Love it. And that time, I mean, to get a almost live or go through all the coursework in person, whether live stream, that must have been a challenge in itself. Because
Yeah.
I love the live stream, but there's nothing better than that in-person learning subset. So, I
Yeah.
mean, going through COVID times, that is impressive to put that all together and then, okay, I'm going to do this, this, and this, and then
Yeah.
apply for it.
Yeah. Yeah. So I applied after doing it for 2 years.
Mhm.
Yeah, I needed the experience, but so I went and I got certified in 2023, January 2023. So I applied in 2022. So basically I had some experience, but I was in the room of the people I applied with, I had the least experience years wise, but maybe not depth wise.
Mm-hmm. I think that is it's a special thing because some people could be at it for a couple years, but some people, if you really grasp it and dive into it, you can have a good handle on it. But I do agree, it takes a couple years.
It does.
To really, I mean, I'm sure you have a library too. I have all my manuals, and I have ones where I look back, this is my first one ever. I didn't know a damn thing, but the notes are still great. So I always refer back to them, and it just keeps you going. So what you're doing now, what I see a lot, is feet and teeth.
Mhm.
And I want your insight, your knowledge to go, let's start with the feet, because you did a post the other day about the new shoes and you trashed Hoka's. And I do too. So people ask me, and no knock to Hoka's, when people come in and they're wearing those Hoka's and I'm, ooh, this is not good. And you see what their system looks, and I know they just came out with the new shoe list. Let's talk about shoes, what you look for, what we recommend, but why?
Yeah. So I really watched the videos that Lori has put out about shoes. I watched all of them recently, and I've talked to her about them too. And I just see the changes in people. And it's so clear as day to me when somebody comes in a barefoot shoe and how I can change their life by taking them out of it. I think the thing about me posting it on Instagram is that I'm not scared to ruffle feathers because I truly believe in what I post. So when I'm posting about Hoka's, I'm not going to be soft about it. I don't the Hoka shoe. I think it is only made for one type of human. I think you should only be in that shoe if you have a lack of big toe extension. And so I think when somebody comes in and they're in a Hoka and they're 20 years old, I make it a little fun. I'll be, you're 20 years old. You don't, unless you've broken that toe a couple times and you have missing great toe extension, which I can look at, you don't need a Hoka. That shoe is not for you. And they'll be like, wait, why? I love it. It's so cute. And I'm, okay, you might love it and it's cute, but let me show you. And once you show somebody what I posted, which was basically showing that that shoe didn't break at the right spot, it just makes sense. So I think that I have this ability to not, I do care, but I don't care that I'm going to ruffle feathers because my information I know is correct. And so to me, I'm going to push it out there. Same with the permanent retainer. That went crazy for me.
That I believe I'm on your side with that, to take them out.
Oh yeah. Well, so I posted a video of whatever, Jimmy Fallon talking about a permanent retainer with another celebrity. I don't really watch TV, but I called him Jimmy Kimmel. And then I talked negatively about why I don't permanent retainers. And I got 6 million views.
Wow. On the Instagram post.
Yeah, I got 4,000 new followers.
Yeah, and this is a fascinating one because this is one where I think I talked to Ron and Jen about, or I had a question about one of the privies, and because it was a dentist, and I love the Invisalign stuff. And I'm one that came up with braces. And if I had Invisalign back in the day, that would have been a game changer. But a lot of people that I know and a lot of clients that I have, the number one fear, and this is what I think it is teeth moving, which I totally get because my teeth moved a little bit once I got done wearing that old metal bracket retainer. But the fact to lock something down that should move, is a problem for me?
So I listened to this brilliant dentist, dentist, talk about this. And she said, anything that we're doing permanent to stop movement, we should question. She said something along the lines. But it's true. Why are we not questioning that we're, first of all, putting a piece of titanium, which contains 18% nickel, into our mouths for 15 plus years to the point where you can't even floss in between your teeth? So I had a permanent retainer. I had braces for 5 years. It's a long time. I had a lot of dental stuff. And I had a permanent retainer that they would refuse to let me take off until after my freshman year of college. I remember it used to drive me crazy. So I got my braces off in 9th grade. So I had that on for 5 years where I was going insane. I hated it. I don't know why I didn't just rip it out. I wasn't that rebellious, I guess, but I should have just, or gone to another dentist, told my mom, I hate this. Can you please get this piece out of my mouth? But I remember I came home from college, after my freshman year, the next day I got it taken out. That's how much it bothered me.
When did you have it put in? What year?
Oh, probably 2007 or something. I had it from 9th grade.
So they were doing permanent retainers back then too.
Oh yeah. I had a metal only on the bottom. I had nothing on the top.
Okay.
Yeah. Oh yeah. They definitely did it for back then. And now I've been reading so much about braces itself, and the bracket braces are just, it depends on how you do it. I mean, I think it depends on it's so case by case dependent, but in reality, permanent retainers, it's nickel. I'm nickel sensitive.
Oh no.
That's the funnier part.
So you look back, your system must have went absolute berserk when you had that in, right?
I mean, I had piercings and stuff like that with nickel, and I had eczema my entire life. So I think there were signs of issues. I'm much cleaner, healthier now. So there were signs, but I would have never put 2 and 2 together back then. Now I'm, wow. There's so many reasons that I shouldn't have had that in, that it is my duty to educate on this topic. Not even because it impacted me, because it didn't impact me that significantly. I'm fine, right? But it is my duty to post stuff so that more information gets spread. And so people become open-minded about it. Polka shoes, whatever.
Yeah. That's really what we do and what we want to talk about, especially on the podcast here, is giving the people the option of saying, hey, we're going to tell you one set of information. Someone might tell you another set, and they can do whatever they want with it. But as much as we can inform someone about if you put an orthotic in a shoe, or you put an orthotic or a permanent retainer in a mouth, what and how it can affect the system. And when you get those people that they maybe don't understand it, but it goes along with the symptoms they're getting, it starts to open up their world of, oh, okay, I didn't realize it. Someone just told me, so my teeth don't move.
Right, exactly. You have to actually think critically about every single thing happening, not just with your body, but other aspects of the world. And I think that PRI and my own health stuff has opened me up to see it. And I just can't not talk about it. I have to. I have to share.
And we all know, I feel a lot of us as practitioners are the most patterned humans. That's how we figured this stuff out. That's how we got into PRI. Yeah. Oh, this worked for me. And then we get people and go, well, don't worry, I am way more patterned than you are. And then it brings someone back down, because no one's ever broken. No one's ever, I mean, they're stuck in patterns, but no one's ever, I can't figure this out, and this is just what my life is.
Right.
We just want to give them that option to do that. And I think teeth are a missed opportunity that's becoming a big thing in our world, in the PRI world, to start talk about, and how that can help people. So your clients, do you deal with a lot of dental clients too, combined?
Yeah, I mean, I actually looked at my statistics. It was 10% of my patients go vision and 10% go dental. So it's not that many. It was something that it's a little hard to tell, but wasn't so many. The majority of people get better with just techniques.
Looking for personalized workout plans? Whether you prefer to train at home or hit the gym, Try a 14-day free trial of the Think Fitness Life mobile app. Get customized workouts, nutrition guidance, and coaching from a qualified professional who will be in your corner every step of the way. Visit www.thinkfitnesslife.com to start your free trial today. That's www.thinkfitnesslife.com.
But I post the vision and dental stuff because that's what people want to see. People are interested in that. But I do, for the people that are not getting better with techniques after 6 sessions, 5 sessions, I have to go down another route to help them. And I don't only go down those 2 routes. Maybe that's what I post about, but
Yeah.
I refer people out to a lot of different things. A lot. I will send somebody to go and do a bioresonance scan and get a scan to get their to see what their emotional markers come up as. I will send people to go do genetic testing. I will send people to nutritionists. I will send people all over myofunctional therapy. So I feel like I really to refer and networking and having contacts that I think are brilliant. I've sent people to astrologists. That's
Really?
more because they ask me. Oh, yeah. They'll be, oh, do you have somebody? I'm like, sure. But I mean, that's not as much health related, but sometimes it is because sometimes it's healing to have a session that, yeah, I'm starting to learn a little bit about this other type of device that I've now sent a few patients to, and it's been profound for them. So I'm going to start utilizing it and sending patients to it. So I go outside that box, but when it comes to vision and dental, those are the 2 people that I really, really work very closely with. I go to those appointments with my patients and I make sure that they are in the right positions when we're either doing a dental appliance fitting, a delivery where they're adjusting the guard to make sure the guard is the right height for the person and it fits properly, or with the optometry, I'll go to the exam and I make sure that their body, whatever prescription we're leaving with, we're getting better results with. Orthodontist too. I just did an email a few weeks ago with a patient that I sent to an orthodontist. I was just in the meeting and listening to what the plan is so that I know going forward what's going to be happening to her mouth so that I can help her the best I can.
Right. And when you do meet with clients or you say a new assessment, I'm sure you're aware of it. And when you look at their cranium and their jaw, but they're coming in with back pain or shoulder pain. And then you ask them, I'm sure you ask them, oh, do you have any jaw pain or their TMJ? And they're like, yeah, how'd you know? It's, well, I'm taking a stab here, but almost every person can get to, we can talk about the mandible and cranium. What point do you start to incorporate that just into their knowledge? Now, yes, we have techniques for mandibles, craniums, but when do you start to bring that just into their knowledge and aware of it to help them in their system as you're treating them?
It depends on the person. Sometimes I am more conservative and I wait a few sessions. But sometimes I've noticed if I bring it up a little bit earlier, it gets them going to the fact that, oh, that makes sense. When it comes to certain things, vision, LASIK, I bring it up session 1. That can present as a problem. Doesn't mean it's a problem. It just means that we might get stuck with a little bit of a roadblock. And so I just don't want them to be thinking that all the techniques I give them are always going to work. So if I see, let's say somebody says yes to a lot of my questions that are dental driven or vision driven, I will tell them, that sounds, there could be something there, but I'm not going to know until we do a couple more sessions. I just want you to let me know if you feel you don't progress. So I will bring it up, but it also is very person specific. If I see somebody who is a perfectionist type A, I'm not going to probably bring it up. I don't want to stress them out. And I'm going to be very laid back in the techniques. Just do it good enough. Don't be perfect. And then if I see somebody who's really doesn't have any motivation, then I might bring it up and be like, hey, you're in pain. And this actually might be why. But I do try and piece together people's stories as best as I can. So, I had a patient last week who had a lot of hip pain to the point where she got surgery on her left hip. I see that all the time because that left hip stays forward. But why? Why in 20-something years old, why is she having hip labrum surgery? And then I find out a year and a half prior, she had LASIK eye surgery. So I asked her, when did this hip start hurting? Within 6 months after LASIK. It was too bang, 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 too obvious. So I piece it together for her. And I say, I think that there's something there to that. And she was, oh, wow. Because that's validating for somebody. I didn't just get pain out of nowhere. We're going to get you in a better shoe. We're going to do all these things. And then let's see how you're doing. I'm not going to throw you to an optometrist yet. I don't think you need it immediately. Just because you had LASIK doesn't mean it's not good. It could be fine. But because you had hip surgery, you have pain post LASIK, that tells me something about how your body responded, how it's holding you.
Did she have a labral tear, or did they go in? Okay.
Yeah, she had a tear. She never had pain before the surgery. So, and I've seen that before. I've seen it. It doesn't have to be. I had someone who had LASIK eye surgery 7 years later. She had hip pain. And it got a lot better.
Do you think the tear was already there and the LASIK eye surgery just
No,
made it worse?
I think that she was patterned and the left hip was forward and she didn't feel anything before. She didn't know that she was patterned. Then you get LASIK and now you really can't go over. You really lateralize to the right side because now your eyes are really holding you there. Maybe she wore glasses, and took them off at night, and that was enough for her body to get back. Maybe she didn't wear them for an hour every morning, and that was enough for her body to deal with that. But maybe she was overcorrected in that LASIK eye prescription, and now she's overcorrected over on that right leg.
And the reason these questions, they're all like the hypothetical questions, but they all are scenarios that could have happened.
Totally.
And if we never find one that really is, oh, that's exactly what happened, it's okay. But you're right. It starts piecing someone together, being, oh, that could have been it. That could have been it. And your hocus shoe and your retainers, your hill to die on. When I hear, because I work in a very sports medicine orthopedic setting, when I hear that doctors go in and do surgeries, or people got disectomies and releases that they probably shouldn't have.
I know.
It drives me up the wall. So I had one the other day, and you feel bad when they open up to you and they say, oh man, I wish I had met you years ago so I didn't have to go under the knife. And it throws a knife through you. And you're like, yeah, I know. But you don't want to say you really shouldn't have had that done. But I understand that point, that was someone's last option to try to get them out of pain. So it does when people are listening to that story or anything, before you go to cut something or permanently change something, I love that word permanent, really find what your patterns may be. And it might not be a PRI person or someone that can find a pattern, but a lot of us, we see those patterns and we're going to drive you to try to understand the patterns from your neurology first. So you can understand it.
And I just had a situation like that where a patient was, I wish I met you before this. And I said, yes, but this is your journey. Mm-hmm. So there are certain things you can say to somebody to make it, there's a reason that happened to them so that now they can be open to see what else is going on. If this happened to them and now there's this alternative method to treat them, what else is going on in the medical system that is missing where they might not be treated properly? And I think you have one experience and it saves you from a lot of them if you can, put two and two together. And I think that is what I try and give them, because there's nothing I can do. I can't take away the fact that there was a surgery that occurred, but I agree with you. And just knowing that that person has seen this, wow, oh my God, this makes sense now. This timeline makes sense now. That to me is, wow, well, you're 25 and you're seeing this timeline now. You could have never seen it, but you were open-minded enough to come and schedule with me. So I think in the end, it's a positive thing, even though for them, it's probably a difficult thing. So I just said, this is your journey and there's a reason it happened. And so you're going to be okay, but let's get you better so that for the future that this won't happen again.
Exactly. And they go pass on the words to someone else that might be dealing with the same thing or heard the same words coming from anyone, that we're going to permanently change something or do something. There might always be another option, or if you haven't looked at patterns or systems, that'd be a good place to look first, because we could circle back and talk about shoes. And when podiatrists or doctors say, hey, you need to get this shoe, you need to get that shoe, and I I do want to circle back because I know you're going to piss a lot of people that I know off about the Hokas, and I'm here for it because I don't them. A lot of people do recommend Hokas for their cushion. They feel good. And I agree with it, but I don't, because it's a neurological. If someone needs that much cushion, their system's telling you something.
Exactly.
So when you look at someone's, let's say, lower body, feet, foot, they come in with an issue there, where are you looking at them first?
I actually start by taking every single patient gets posture pictures that I don't post on Instagram or anything. I always take pictures of people just because if I'm working with somebody for a year, I want to see a change. I don't take it always on the follow-up session, but I will take it if I know, oh, they're done or they're almost done. So I always start with pictures, and I always do a gait analysis. Same thing, standing, reach, squat test. Same thing we all learn in PRI, hip range of motion seated, adduction drop test. I'm just going in my head through all my tests. Shoulder. Yeah, shoulder, horizontal abduction. I do all the testing. And the assessment, especially the first time of somebody, I might see some differences, but a lot of it is what they're telling me in that story. So I do a 30-minute history, at least. Sometimes it's 40, sometimes it's longer, depending on the person's history. I get a lot of information from that person's history. And also what their asymmetries look visible. The visible asymmetries tell me a good amount. So I'm looking at their face, what eye is higher, things like that. And I want to even get so much better at that. That's my next thing, is to be able to really hone in on learning about facial asymmetries and what that means to the cranium. I really am interested in the cranium. So yeah, so I do the typical testing. It's just that the history portion tells me so much. That's why I think it's so important to ask the right questions and then be able to decipher what people say and then feed it back to them in a nice way with PRI. But yeah, I don't remember where we were going with it, but hopefully that answered.
No, yeah. So you got that. You go through. Let's say a foot-specific person that wants gait. The next thing, they're really, hey, it's a foot issue, which
I still do all
might
of
not
it.
be. All of that. She does all the tests.
Neck.
Are you going to look at, people get fixated, right? If there are pains in their foot, they want to address the foot. They don't care if we're going to talk about a right shoulder.
Yeah.
But yes, we are, but we'll get to it. Where do you go for a lot of your gaits in runners? Because we do a lot of gaits, and I love this talking about gait and running, because when most people, you go to a gait, they go, okay, you need to change your stride length, your frequency, all that. But they never talk about, okay, flat foot's not bad, but high arches, this and that. When you get those questions, where are you guiding them with shoe recommendations and techniques and sense?
Yeah, I mean, I will pull out a shoe and I'll compare it to whatever shoe they're in, and I will explain to them. And I'll even sometimes I'll pull up calcaneus and talus bone. I have an app, and I'll say, this bone has no bony attachments right here, your talus. This bone dictates whether you're going to have a higher arch or a lower arch, along with genetics. But that bone, if you are in a position where that calcaneus is not properly guided, supported, put in the right position, with our modern day society of what we walk on, we're not walking in the jungle, we're not walking in the desert, we're not walking on the sand the way that our ancestors did, the way that we are supposed to move our bodies. We need to give our bodies that feedback that we're not getting. We're not getting that feedback that we're supposed to. And so then I'll show them what a heel counter feels on my shoe. So I really do a lot of tactile stuff because that's how I learn. I'll explain to them about, it's not bad if you have a flat foot or a high arch, but you might need a little extra support. You might be looking for the ground. So I will point things out when people walk. I'll have people walk. I'll say, do you feel your arm swinging? But it just depends on the person, what I see or what I don't see. No rotation. Do your arms ever swing when you walk?
And
so
when you ask them that, they look at you and they're, I don't even know what it feels for my arm swing.
Right.
And these arbitrary questions are the questions that you and I probably love the most, because when someone's there and they're, I don't know, I've never really thought about what my foot feels on the ground.
I know.
To most people, that's going to be probably a normal thing, but to practitioners, that's us taking notes, being okay, sensory awareness on this person might
Low.
not be the best, and we need to bring some back to it. And it's in the journey of PRI, I'm sure you come to learn it. We have these techniques, and people love the 90-90s and they love all this stuff, but it's all about sensing and feeling and telling the
Everything.
brain what to do.
It doesn't matter what technique you do as long as you can get the brain to feel it and sense it. I personally took me a really long time personally to get a 90-90 and feel a 90-90 because I was a patho PEC. That did not work for me. It took me almost 2 years to feel my left glute in a side lying position. So I am not a stickler on techniques, on form, or anything like that.
Mhm.
I just want to get the person to sense. And if I have to break it down and major modify it, I'm going to do that. Because that's what matters is sense and then holding and having respiration.
So you went to Myokin and they were looking at the 90-90 is the king, right?
And that didn't work for me.
And when did you realize that it was wrong when you took pelvis and they're, well, actually the 90-90 is not good for patho PECs?
Yeah. When I took pelvis, I did realize that I needed to do wall with chair, IOA TA, and I did that for a month. And it helped me a lot. Some other ones that really helped me are long-seated crossovers. That was a game changer for me. Certain ones where you're really crouched and compressed. And anything standing, I typically do better with. So even standing respiratory squat. Yeah, because your visual system has to work when you're standing. And for some reason, when I go side lying, even left glute now, it's still really hard for me to find, but I can find standing supported respiratory squat. I get my left glute, no problem. So I know this about myself. I know certain patients are going to be the same. They're going to have problems with some techniques and not all. So I have a plethora of ones I do. There are so many techniques I've never tried that are PRI because there's so many.
Oh, yeah.
Ron's a genius. It's unbelievable.
And when you do, it is awesome because then you go to some of the courses and have you taken non-manual technique yet?
Yeah. I
mean, that one just blows your mind because you just see ones that are tucked way in that manual and you're like, I've never seen it. But I always find it interesting because people go to the normal ones, the 90-90, the all fours, and trust me, I love them. But once I found out that you can almost do any technique depending on the person and get similar results, but it also becomes, you said, person dependent.
It is.
So that people are listening, they're yes, the 90-90 hip lift's great, but it might not be for that person.
Right.
You have clients that I'm sure love a hemi, glute max, and I have ones that love certain ones, and those are their go-tos. They're never going to leave those, even though we get them upright and do all other techniques. They're still, I'm going to go to this side lying right glute max because I love it and I feel it.
I mean, and I don't think there's anything wrong with that. If there's something that person really likes, that's another thing too. I will always ask my patients, well, if I do more than one technique with a patient, because sometimes I'll try. If I did a 90-90 with them and they didn't feel it properly, I'll be, all right, I don't get this. If they don't get what I'm looking for after me trying twice, I move on. I give them something new. I don't even send them home with that. So then if they get it, and let's say I try 3 techniques or 4 techniques and I only send people home with 2 or 3, I'll be like, which one did you best? And I'll send them home with the one they best because a lot of it is what they. You're only going to do what you. I have techniques I promise you I'm not going to do them on my free time.
Yeah, and it's a lot of times what my clients it's too complex, it's too complicated, they can't do on their own. It's same thing that their systems it's not for them to be on their own. They can get it when I'm coaching them, but I feel like that's the best part. One of the best parts about that is you're building that client relation to be like, hey, they neurologically trust you, but you're going into worlds beyond what they think about, but they'll pick one exercise and this is it. This is the best thing that I do. My back pain's gone, or it really helps me. And sometimes I look and that's level 1,
I know
myokin, but it doesn't matter.
It doesn't.
In my head, we need to get you upright. We need to get all this. And they're nope, I'm good. My back hasn't hurt in a couple weeks.
It's true though. If I am hurting, I will always do a left adductor pullback, period. It makes me feel better immediately.
That's your
Like
go-to?
I typically will do it after I work, to be honest. When I'm done working, I'll do 1 or 2 sets of adductor pullback and then I commute home. I feel so much better. I don't have to do more than that right now.
Are you going side lying or seated?
Sideline.
Yeah. And
Yeah.
I should start asking more people what their go-to technique is, because mine is the sideline right glute max resistance.
I like that one too.
That one opens me up because it takes me out of my right side and my right lower back. So I think everyone, no matter what it is, any person, athlete, client's going to have that technique that's their go-to. And it might take a while to find it.
Right. And I think that it's good to know that once you've been doing this stuff for a while, so you could just throw it in. If you're working out, throw it in right before workout. I do think that, knowing your body enough, but these are athletes we're talking about here. General people are going to be like, well, I don't know. But if I do 6 sessions with somebody, they have a lot of techniques. They'll have 20 techniques almost. So I'll say, well, sometimes I'll be, why don't we go back to this one? You this one. Did you this one? I'll make sure. And then if I want to repeat, I'll repeat. Not always, but sometimes. Right now I'm on a trip, right? So somebody reached out to me and she was, well, which one should I do? So I looked back at all her techniques and I'll do these 3. And you liked this one. I remember you liked this one. Is that true? Because I was, let's just rearrange what you're doing right now. And then when I see you, we'll change it again. So I think for some people that can be really useful.
Oh yeah. And for right now, are you integrating your training, strength and conditioning into PRI? Are you a strict PRI practitioner? Where are you at right now with your career and what you got going on?
So I'm not really doing the strength components. I lifted weights my entire life, literally, since I started lifting weights at, 18, and I lifted for years. And so I'm burnout actually from lifting weights. So I took this 5-week trip and I didn't lift at all. And this is the first time in my life that I've taken off this long from just lifting. So I needed a break. I've been hiking almost every single day. So I'm doing stuff, but I needed a break. And so I'm not, but I do think that there is a very open space for strength and conditioning to merge a bit with PRI. And I think a lot of it comes down to understanding these asymmetries and just training for that. I'm not doing that right now. I am currently in the process of launching a membership. It is on the way. It is for people that are interested in being part of a community where PRI is really the base of that community, but then also learning about holistic health and just being able to better yourself. People might be in pain, people might not, people might just want to learn, but I'm putting all that together and I'm packaging it for people where they can learn and we could talk about a lot of different topics and go deeper into the things I post on Instagram ultimately. So that's my biggest thing. That's what I'm working on. Yeah, I've been working on it for a while. So I'm excited to release it eventually in the next month here or so. And it's going to be, it'll be for providers too. It'll be for regular people. I'm assuming I'm going to get a lot of moms interested in their children, airway and all that stuff. And my thoughts on that. I'm also thinking I'm going to get a lot of people that are learning PRI and also people that are struggling and they know PRI can help them, but they don't have a provider near them. And that's really who I target because those are the people I feel really deeply for. Someone in Sweden that doesn't have a provider near them. And I am not going to be doing any more virtuals. So this is my way of still being able to help people from afar.
And I assume that says it's going to dive into not just the base of PRI, but we're talking vision, dental, foot. Is that going to cover a plethora of things?
I'm going to make it more broken down, obviously, than how we learn it from the Institute, because I'm not trying to teach PRI. I'm not able to do that.
Don't go down that road.
I have so much respect for the faculty members. I really have so much respect for the faculty members. What they do is unbelievable. I think that somebody needs to do a bit of a breakdown for the general public. And I don't want to teach courses. I don't want to teach for providers who want to learn because they can go to the Institute and do that. That's the whole point. The Institute does it best. So I'm not going to try and break it down, but I'm going to teach it towards that mom who has an 8-year-old and she got 2 opinions from dentists on what type of palate expansion to do. And she doesn't know what to do. That's my
there it is.
plan.
Okay.
So so I'm trying to get it towards the people that are not going to go and learn PRI themselves, but they need some guidance. And I'm going to do my best because every case is so different. But I am going to go in there and try and do videos talking about, vision, dental, shoes for sure. I've already done and recorded all these. And then I do want to go deeper into, let's talk about progressive lenses. Let's talk about monovision. So I'm going to do videos on all these different topics, but it's going to take time for me to come up with all that content. But a lot of the content is going to be driven by the people in the membership.
Of course. Are they gonna be able to ask what they want? And you're gonna be like, okay, we will provide.
Yep. Q&A, there's going to be Q&As. There's going to be interviews with all the PRI faculty members I plan to interview. So I'm really trying to make it very PRI driven at the base of it. But ultimately, it's also just about finding your own way towards holistic health and learning, and in a way that makes it easier for the general public to understand what we do, because what we do is not easy for the general public to understand. No.
It's honestly, sometimes it's hard for doctors to understand because they've learned a certain way. And what I love to hear about this is because it's going to push back against your traditional medicine, orthopedics, whatever ideology. Not to say that any of that's wrong. It's just how they were taught. And it's molding that culture going forward to understand the integrated system that we are and how that can be applicable to any lens that you look at. So it won't just be, we all have specialties, orthopedics, podiatrists, all this stuff, but that all has to be looked together. You can't go to a podiatrist and not think a ophthalmologist can't be involved.
Right. I mean, that's the thing is it needs to all be branched together, and people aren't really talking. And I feel that's my specialty, is networking with people and making connections. So that's what I want to do. I want to network and I want to make connections and I want to put people in touch with each other. I want to help people find people to help them, because I'm one person, but that's really what makes me happy. I love my job, but I love connecting and learning about other people. So I think that there's so much that can be done. So, yeah.
And so you said, when is that coming out? By the end of the year, or when can people expect that?
Yeah. I mean, I'm trying to get it out here. And I mean, it was supposed to be end of March. I'm not sure right now about April, because April is a weird month too, but we'll see, maybe in the next 3 to 4 weeks. So it's coming soon. I've been working on it for a while. I'm really, really excited for it. I know people have been asking me for a long time about something like this, and I think that I can do it right. And also really credit the Institute, because this is something that to me is important. The Institute taught me this. I didn't come up with this. I have my interpretations of everything, and I have my holistic health knowledge from the things I've been through. So it is me. People are coming for me and my thoughts, right? But when it comes to the PRI, that's not my material. So I'm going to credit them, because they deserve the credit. Yeah. So that's where I'm at with all of it.
Perfect. And in training clients now, what does that look for you? Are you solely just PRI practitioner? Are you doing personal training? Is it a little bit of both?
I have maybe 2 people that I've personal trained for 7 years that I still do sessions with, because I love them, but
you can't let them go.
No, but I solely do PRI.
Awesome. Yeah. And you're out of New York, right? Is it in person, virtual? Where can people really, if they're hearing this, where do they go? Obviously Instagram. We're going to get to that in a second. But New York, where can they find you?
I am in New York City. I'm in New York City 2 times a week. And then I am also in Long Beach most of the time. So Long Beach is a town on Long Island. So that's mainly where I am. I'm not doing virtual anymore. So they can find me there. And there's a way that they can apply to work with me on my website if they don't live in New York, and try to set stuff up with that too. Because people will fly in and get care that way too. Especially, once I launch this membership, the goal will be that everyone will go through that first. And then if they really need still care, so I can make sure that I'm weeding out. I don't want to give you that care unless I know for sure you need it, Vision and dental is what I mean. I don't want to waste your time if if you don't need it. So that's where it's at. So it's going to be the membership. It's called Rooted Well, and it'll be out soon. And then you can work with me in New York in person.
And we'll put it in the show notes, but your website, what is that? Where can people find you?
Yeah, it's just my name, aleenakanner.com. So, yeah.
Keep it simple. And it's on Instagram too. It's Aleena Kanner.
Yep.
The handle's simple. Great content, great PRI insight. So if anyone's listening to this and wanting to learn more, go watch some of the videos. It's controversial. We get because that's what threatens the system to help someone learn and understand why something might be really good, but why something might not be good for your system. Anything else? I know I took about an hour of your time and I really appreciate it.
No, thank you so much.
Awesome. Well, I appreciate you coming on.